Hi, good afternoon.
Hello, how you doing?
I'm good. Welcome, Lieutenant Nalepa from the Tioga County Sheriff's Department, head of the Road Patrol Division.
Yeah,
So, thank you for joining us today. We have been hosting virtual coffee chats with people who have been really important and involved and helpful in our coalition work. And we're kind of doing I don't want to say a rapid fire, but we have 5 questions that we're asking. And we're happy that you joined us today.
well, thanks for having me.
Yeah. So let's get right to it. Question number 1. What is the new normal looking like for you in your sector as law enforcement?
Well, for us, it's a lot of precautions as far as what we're doing with ourselves. We're wearing more personal protective equipment, um, limiting our contact with the public, and also trying to control contact within our own department, which isn't very easy sometimes when, a lot of our what we do forces us to have physical contact with suspects, sometimes doing, arrests, even CPR. We've had a couple cases since the COVID virus epidemic where we've had deputies having to do CPR and perform medical tasks on people that exhibited symptoms prior to this. We're also trying to, yeah, manpower issues we've had inside here, just because of quarantining and just by um, chances being so much more significant of contact. We've had a couple people get quarantined where they're isolated in their residence for a week and a half. As far as the crime and stuff, it's actually been eerily quiet because most people are self quarantining.
Well, good. I mean, it sounds like you guys are doing everything that you can to be safe and protect yourselves and continue to protect the community, which you always do.
Oh, thank you.
Thank you for that. So kind of switching it a little bit more personal, how do you take care of yourself during this
Uh, Basically, wearing the face mask, following the CDC guidelines, um, keeping the social distancing, everything that is being told to um, the public is what we are doing, not just as deputies, but we're doing it at home. When I had an exposure, I didn't see my wife. She had to. I was down in the basement, and the joke was that she had to feed me through a slot in the door with a metal tray, and I passed the tray back up. But it's difficult for us because not only are we worried about ourselves being exposed, but we don't want to bring anything home to our families either.
Yeah, absolutely. Have you established any kind of like self-care routine during this time?
Yes, we actually have, as far as the sheriff's office, we are wearing the mask. We were actually a little more stringent than what the CDC guidelines were. We were wearing the mask indoors at our office, even if we're more than 6 feet from people, just in case we ran into another deputy, another employee. We don't want to bring that. Um, if one of us, God forbid, gets it, we don't want to anyone else to catch it, and even worse, we don't want that going into the jail because that brings a whole another slew of issues there. But we're disinfecting the cars before and after each shift. We are, I mean, we're sanitizing everything. The hand sanitizer that we got from the state, the office smells like that. It's almost second nature at this point. But we've allowed it to ease down a little bit with the guidance from the county legislature. So, but we are still wearing masks when we're anywhere near people, even within our office, even though that is not mandated by law.
Well, I'm glad that you are staying safe and taking care of yourself. And sounds like you've had, some firsthand experience with being quarantined and, having to worry about your family and kind of isolating yourself from your family. And just kind of a reminder that this hit everywhere and all close to home for everybody. So what is one good thing that you've seen that's like inspiring or positive or uplifting in your work or community or in your personal life?
Well, I mean, as far as I'll start with professional, we've seen such um, acts of kindness from people in the community towards us, towards healthcare professionals. We've seen people are sending us food, cookies. I believe it's I can't think of the name of the charity, but it's Hugs for Rah Rah Rah, I think it is. A lady from Appalachian who, unfortunately, her mother died of the COVID virus, has taken that as a opportunity to give back. It was an inspiration, and she's helping healthcare workers, local businesses, police, fire. So we see that, and it actually goes a long way by motivating us. And when times are tough, it's a lot of people. We get kind of, hate to say it, but sometimes we get a little cranky with each other around here because it's just we're on edge about the virus too. But little things like that really help. As far as personal, I know a lot of people. I see a lot of people just asking, "Hey, do you need help? Hey, you can I get you something from the store?" I know at my church that the donations for like Easter were way up, and everyone is trying to make things better for everyone else who can't get out and get that stuff. So it's this dark cloud. There's plenty of silver linings to see if you're looking for them, and a lot of them are right in your face too. So it's really good to see.
I love hearing that so much. And throughout the course of these interviews that we've been doing with different sectors, we keep hearing the same message over and over again about the inspiration coming from the community, coming together, from people volunteering and just charitable acts of kindness and concern for everybody else. And that's been probably the best part of doing these interviews has been hearing everybody else's experience with that kindness and people coming together. So if you had a message that you would like to share with others, what would you like them to hear?
My message would be, I know it's very tough to be confined to your own home or apartment with some people that, even if you're family, you love them. If you're in the same space together, I can understand it. You getting where it might not be as comfortable as it once was, but if you get a little longer, keeping people safe, it looks like we're getting some kind of hold on this, and just keep chugging. It will be done. It will be a thing of the past, and everyone that went through it will say, "Yeah, I lived through COVID-19 of 2020, and we did it right, and that we actually we're successful in mitigating the effects of the virus."
Yeah, absolutely. All right, final question, and we have to ask this. We have to end on this. Why is being a part and being active in the coalition so important to you? You guys have helped us with many different events and always a partner in our prescription drug and medication collection events. And why does being a part of the coalition ring important to you?
Well, I mean, we are trained for law enforcement and making arrests and enforcing different laws, and most of the people that are in this profession want to help people, and we know our skill set, but we also know there's skill sets of other people. There's drug counselors, there's people that might help people get a place to stay, things like that. So the more we cooperate, the more we can draw on each other's skill sets and actually lift up everybody instead of everyone kind of one hand not knowing what the other one's doing. And I know I've learned a lot, and my attitudes have changed a lot over the years by working with different people of different disciplines. And I hope it's the same for everyone else, but I know at the sheriff's office, we are really, we take a lot, even if not everybody goes to coalition meetings. You know, we only send one person. We bring that stuff back to the office, and it goes through the whole department. So there's a lot of great value that comes from these coalition meetings, and looking forward to going to them in person again.
Yes, me too. And yeah, I just once again thank you for being here with us today, and thank you for you and your commitment, and also everybody else at the Tioga County Sheriff's Department who continues to work throughout this time to help keep our community safe, and then of course all the work that you've done to help bolster our coalition efforts over the past few years. We definitely look forward to partnering again in the future in person, hopefully.
All right. Well, thanks for having me, and thank you to the coalition.
Thank you so much, Shawn.